Hi, let's run through the drainage of the head back to the heart. So first slide is discussing the dural sinuses. These are venous sinuses in the cranium that are formed by the Dura Mater. Take a look at a couple pictures in a moment. But we'll start with the superior sagittal sinus, which then drains into the transverse, which drains into the sigmoid, which then drains into the internal jugular. And then we are down the neck. And of course, around here is the jugular foramen that we will have to pass through. I'll write jugular F for jugular foramen. We'll also take a look at the right and left internal jugular veins. These are the largest that are draining the cranium. That's these that are a continuation of the sigmoid. And we'll look at the right and left external jugular veins, which are smaller, and the retromandibular veins, which drain the scalp, face, teeth, etc. And then the brachiocephalic veins back to the superior vena cava, back to the right atrium of the heart. Just an illustration of the Dura Mater. Remember from anatomy, it's a tough, inelastic covering over the brain. Here it's been cut and reflected and pulled back. There are arteries and veins that run through it. And you might notice, if you can see the type, that's small. There's a branch of the middle meningeal artery. So the Dura Mater are one of the layers of the meninges. The slide is also pointing out the superior sagittal sinus, which drains venous blood. We'll take a look at that next. But we're draining the venous blood from the brain. So here is a coronal view of that superior sagittal sinus. So let me back up just a minute. So it's taking a slice through there, a coronal section. And the blue is the venous. The gray area is the Dura Mater. So it wraps around and it goes on both sides. And it just forms this large sinus along the sagittal plane, fills with venous blood, draining the blood from the brain again into this sinus, which will then drain out through the associated dural sinuses. One thing to note, in addition to, this is how the cerebral spinal fluid returns back to the bloodstream, but that was for ANP1, which we're not talking about, that's just a reminder. But there are these emissary veins that you should appreciate. I mean, take a look at where they go. They're out here on the scalp, the soft tissue of the scalp, and those emissary veins go from the scalp, they pierce through the bone, and then they wind up right into the superior sagittal sinus. So there is a potential transmission route for infection. So a scalp infection, there is a direct path into the brain. So any infection in the head, neck needs to be treated aggressively. Another view of the superior sagittal sinus. This illustration is a little bit dark. There are a number of these dural sinuses, most of which I'm not going to discuss. There's an inferior sagittal sinus that we're not going to talk about, but this is the superior. Runs all the way along the sagittal plane, and then there is a sort of a confluence of various different sinuses we'll take a look at next. So, superior view of the skull. At the bottom of the illustration is the superior sagittal sinus that's been cut. It's come down from the top of the head to this point. The blood then continues on both to the left and to the right along these transverse dural sinuses. And the Dura Mater forms this tentorium that separates the cerebellum from the cerebrum, but we're not talking about that either. The blood continues on through this transverse dural sinus, and then it drops down inferiorly and then drains out through the sigmoid. So sigmoid means S-shaped. And then it would pass out through the jugular foramen. One other thing that I want to point out in this slide is the cavernous sinus. So we'll take a look at this a little bit later in another couple of slides. But this is the cavernous sinus. It's on both sides, of course, but the right side has been removed, so you can see the trigeminal underneath it. Pituitary gland in the center. And these large bilateral cavernous sinuses have a number of cranial nerves that pass through them, as shown in the next slide. So here again is another coronal section through the through the cavernous sinus. So backing up a little bit, the slide that we're looking at cuts right through here. So that's the view that we're looking at in the next slide. So the cavernous sinus in blue, the internal carotid loops through it, but the pituitary gland is in the center. But note that there are 5 cranial nerves that pass through this dural sinus. And these again are ones that we've looked at before. Cranial nerve 3, 4, and 6, all going to the eye, the oculomotor, trochlear, and abducent. And we also had B1, the ophthalmic nerve. All 4 of those were going out through the superior orbital fissure. Also have the maxillary nerve, V2, passing through the cavernous sinus, and that exited through the foramen rotundum again. So again, blood infections in the brain, it gets into the sinuses. The blood flow is slow and sluggish. It sort of sloshes around because there aren't a lot of veins, and there's potential involvement with cranial nerves. So again, bacterial infections in the head, brain, and neck can be disastrous. Another view, a model of a few of the dural sinuses, sort of a sagittal view of a skull. Somebody took the time to build these dural sinuses in wax. So here is the superior sagittal sinus. And then it's showing just the left, and the transverse, and then the sigmoid. And then that goes out through the jugular foramen, and then there are these 3 structures that pass through it. It's hard to see in this illustration, gray, but the internal jugular is shown in gray, and the internal internal carotid artery is shown in red. They run together, and the vagus nerve is running with them. So there is cranial nerve 10. And those run together, as I'll point out in another slide. So it's just kind of a neat model to show those 3 dural sinuses. Those are the large ones. So a couple of notes on the jugular veins. You have to keep the internal and the external straight, just like you have to keep the carotids straight, the common, the internal, and the external carotid. So a couple notes on the internal. It's the largest. That's the one that we just saw draining the sigmoid sinus via the jugular foramen. Begins at the jugular foramen and, as I mentioned, runs with the carotid artery and the vagus. They all form in this carotid sheath, which is deep to the sternocleidomastoid. So when you take a carotid pulse, you're finding that sheath, sort of the medial side of the sternocleidomastoid, and you're palpating the carotid. But the internal jugular, the large one, is in there also. So you should be able to look at a figure like this and rather quickly identify these veins. These are the large ones. So we have a right and a left. Internal jugular vein merges with the subclavian veins, right and left. Those two merge and they form, right and left, brachiocephalic veins, which then merge and they form the superior vena cava, which goes back to the right atrium. So that shouldn't be any trouble. Likewise, you should be able to take a picture like this and rather quickly label these, the largest ones shown. If there's nothing else shown, assume that those are the internal jugulars. And you know, these are the subclavians. They merge to form the brachiocephalics, right and left, and the superior vena cava, and you're done. Just more of same. So make sure that you kind of just see this in your mind's eye, how they're going, and put the labels on them. And while we're at it, you should be able to identify the red blood vessels. Right and left common carotid. And over here, this would be the right subclavian and the left subclavian. And that would make this the brachiocephalic artery, or the brachiocephalic trunk. Okay. So the external jugular, it's much smaller than the internal, crosses the sternocleidomastoid muscle. And this is the one that often you see bulging or distended on the side of the neck when straining or lifting. It's clearly visible in many people. And it's also shown on some lab models, but we don't care about that since we're not doing lab. So a superficial view on the left side of the illustration, deeper view on the right side of the illustration. So on the left side of the neck, the internal jugular is shown. The SCM and several other muscles have been cut and removed. So there's the internal along with the carotid. On the right side of the model's neck is the external jugular vein. And it's going right over the sternocleidomastoid, which is basically here, attaching to the mastoid process. So that's the one that you see on the outer superficial side of the neck. And there's a note here if you want to play around with this. Probably not a bad idea since there's a final exam coming and who knows what's going to be on it, but can you identify a number of these muscles? So for example, you know, that one, etc. Okay. And now to drain the head, face, and teeth. So, superficial temporal vein, it parallels the superficial temporal artery. So a lot of these major veins and arteries are paired. And there are parietal and frontal branches of that as well. Now, when the superficial temporal vein descends, it gets to this point where the maxillary vein is. And at that point, the superficial temporal vein ends and the retromandibular vein picks up. So the retromandibular forms by the superficial temporal and by the maxillary vein. So the maxillary vein is a little bit hard to see, but it's running from this pterygoid plexus over to the connection with the superficial temporal. So the maxillary artery is right in here. So that's the maxillary artery. I'm going to erase that. And then we have the retromandibular vein. So we had the maxillary, we had the superficial temporal, and now we have the retromandibular. And it has an anterior branch and a posterior branch. So what I've drawn in yellow is the retromandibular, and I'll erase it in a moment. And there are other slides that sort of show this as well. And then we have the occipital and the posterior auricular also draining in, which I didn't label. Okay? So I'm going to erase the yellow off of the retromandibular. And then let's look at the facial vein. And the facial vein merges with the angular, and there are many anastomoses with the ophthalmic, but this is draining the face. It parallels the facial artery, and there are again superior labial and inferior labial, which are shown better on another illustration. But to continue with the facial vein, paralleling the facial artery, again there are submental branches, but the facial vein runs up to about here. And then it merges with the retromandibular and then drains out through a common trunk here. And several other veins, some lingual veins can also merge there, but that's the general picture. So if you're coming along the retromandibular or the facial, there's potential to go either direction, either out through the external or down to the internal. Either one's a legal route, and it probably just depends on pressure differences, what vein is being compressed where, as to where the blood will flow. Because remember, there aren't veins in the head. They're essentially missing. They're very, very few. So we also see the inferior alveolar. So it's shaded, but it is draining. Let me clear up some of this. So the inferior alveolar is draining the mandibular teeth through this inferior alveolar vein, which is paralleling the inferior alveolar artery. I'm highlighting the veins in red, which hopefully that won't goof anybody up. And then it continues out of the canal through the mandibular foramen again, and then it merges with the maxillary vein typically. So if you're tracing a drop of blood away from the mandibular teeth, you just drop it into the IA vein, up to the maxillary vein, to the retromandibular, and then take your pick. Either out through the external or out through the internal. Either one would work just fine. So there are the mandibular teeth. The maxillary teeth are not as clear, and I have looked high and low for a good illustration of the posterior superior alveolar veins, and they are very hard to come by. So this, I have a couple, but let me erase everything on this slide. So what we're going to be looking at is, well, let's just do it this way. The cavernous sinus and the PSA vein, they all drain into this pterygoid plexus of veins. It's a rather conservatively small illustration, but for the sake of illustration, they've kept it rather simple. But the PSA is not shown well, but it's coming out of, you can see the vein highlighted in, or shaded in blue for the maxillary teeth. And then it doesn't show it well, but it's coming out right about there. And then it drains into the pterygoid plexus. So it's coming out, and then it goes into this. And the pterygoid plexus of veins, there are many anastomoses, but the main one is then out through the maxillary vein. Maxillary vein is very short. So it receives blood primarily from the pterygoid plexus and from the IA. Okay. Oh, no. It just, hang on. Late at night, the electrons must be getting lazy. Just a minute. Oh, where did they go? Hang on. Well, I don't see them anywhere on here, but I'm still recording, so just hang on a second. We can get them back. I'll just have to re-import them. I hope we didn't lose all of our drawings. We shouldn't have. Everything's being recorded. So, all right. I think I was about done with this slide anyway. Sorry about that. I don't know what happened. So let's go to the next slide. So a different illustration, again showing this pterygoid plexus of veins. One thing to note is that the facial vein, I highlighted in red, and I realized right after I saved it, that coloring it red wasn't the best choice of colors. I was just trying to outline it, and it looks like it's the facial artery that I was drawing. It's not far off, but what I meant to do, I should have chosen a different color, was just to highlight the facial vein, and this is pretty straightforward and obvious, and then it kind of comes over here and just continues on into the external jugular, or excuse me, into the internal. So, shows the maxillary vein again. It's relatively short, and the PSA veins are not labeled, but they're coming out of the maxillary tuberosity. So you should be, I highlighted the retromandibular vein also in yellow again and bracketed it with the green loop. So again, an anterior branch and a posterior branch of the retromandibular vein. Okay, so here's an illustration that I found that's just good practice. So you should be able to identify most of this stuff. Pick something that's easy to get started. For example, maybe 5. Should be able to identify that as the external carotid. That would make this the internal carotid, and this would make this the common carotid, CC. And you know the 3 anterior branches. So we had the subthyroid, and then 4 are the lingual. Those were next. So those are the lingual arteries and veins. And then next is the facial artery, parallel to the facial vein, so that's not bad. And then 6 is the large jugular, so there's the internal IJV, internal jugular vein, and 7 would be the external jugular vein. And then number 2 here, you should be able to identify as the the external carotid still. And then it ends up here, and we have the superficial temporal artery and vein, and then that would make this the maxillary vein, or excuse me, the maxillary artery and the maxillary vein. And yellow is just not the best color. So max, A, and V. And this one I haven't really talked about, but this is the transverse facial. You'll see it labeled. But I haven't asked you to know that one. Okay? So highlight where the retromandibular vein is. So it would be from where the superficial and the maxillary join. So this is the retromandibular. And then there is this anterior branch, and then there's the posterior branch. Okay, good. And here is a better view of the side of the head. You should be able to identify much of this. If you just spend a little bit of time, the labels are still clear. You should be able to identify the facial, of course, and the superior label, the inferior labials. And here is the maxillary vein. This is showing 2 maxillary veins, variation. And the retromandibular, the anterior branch, and the little short posterior branch, and then the external has been cut. And you can enlarge some of these labels if you want to really zoom in. The next slide, though, takes a look up here in this region where it shows the PSA, the posterior superior alveolar veins, leaving the maxillary tuberosity. But you really have to zoom in and pay attention to that. So I tried to do that in this slide. Just enlarged it and highlighted the PSA vein in the green box, and then drew these this little yellow leader line in. And you can, in this view, you can sort of see those veins coming out of the bone. So, at any rate, those are the PSA veins. And that pretty much wraps up what I wanted to cover for the drainage of the head. The next slide just has some basic practice problems. So, trace flow of blood to the heart and lungs, major vessels, valves, and chambers. You should be able to do that, right atrium, right ventricle, etc. You should be able to get blood to all of the teeth. So this is arterial blood. So if you're going mandibular, you need to go through the IA. And if you are going to maxillary teeth, you need to go through the ASA and the PSA. So get the basic picture down to different regions of the face. Maybe, for example, maybe something easy, maybe the mental region, maybe the scalp, which would be your superficial temporal arteries and veins, maybe the infraorbital region, etc. And then to the sublingual and submandibular salivary glands to remember which branches of the external carotid supply those. You should be able to go to the muscles of mastication, again, branches off of the maxillary artery, to the tongue. Lingual would be a good choice. To the palatal mucosa, you could go through the sphenopalatine or the descending palatine. Brain, the dural sinuses, we've run through that, so you should be able to connect those pretty easily. This is just pointing out that there is communication between the cavernous sinus and that pterygoid plexus of veins. And then those connections between the pterygoid plexus of veins, the facial, retromandibular, internal, and external jugular. We did that several times. And then this idea of those emissary veins passing from the scalp through the bone into the brain. So just some basic review problems for you to think about. I think for your field of study, the teeth and the associated soft tissues would be good tracing problems, salivary glands, etc. Okay, that's it for blood vessels. I'll do a very short lecture on lymphatic drainage and lymph nodes. So that'll be the last of it. So until then, bye-bye.